Assalamualaikum warahmatullah and a very good day to all. My name is Zulhafiz and together with Loh Jun Hao and Qarnain, we will together present to you about a newly approved drug by US FDA which is called as Pivmecillinam or also known as PIVYA. For introduction, PIVYA is a penicillin class antibacterial indicated for the treatment of female patients who are 18 years old or above with uncomplicated urinary tract infections. These infections usually caused by isolates of E. coli, Proteus mirabilis, and Staphylococcus saprophyticus. In order to reduce the development of drug-resistant bacteria and maintain the effectiveness of PIVYA and other antibacterial drugs, PIVYA should be used only to treat or prevent infections that are proven or strongly suspected to be caused by this bacteria. Now we move on to the drug discovery and target part. Pivmecillinam is actually an oral beta-lactam agent and prodrug of mecillinam, which is discovered in 1970s. So if you can see on the right part of the slide, you can see the difference in structure of mecillinam and pivmecillinam, which is in pivmecillinam structure, there is an additional part added to the structure. So since it is a beta-lactam agent, it will work quite the same with other beta-lactam product such as penicillin, which they will bind to the penicillin binding protein to site and inhibits the bacterial cell wall synthesis. Lastly, US FDA has approved the use of PIVYA on 24th of April 2024. Now let's move on to the next part.
Now, moving on to the first animal studies conducted for pivmecillinam, that is the efficacy study by Zykov et al. 2020. In this study, they tested two doses of pivmecillinam which mimic human doses, 200 mg and 400 mg in mice with UTIs to see how well they fight the infection caused by E. coli. And the observation was that both doses showed good result against E. coli strains, particularly by reducing the bacterial levels in the urine, kidney and bladder. So, the next study is the developmental toxicity studies in which they administered pivmecillinam orally and subcutaneously during organogenesis to rats and mice at doses higher than the maximum baby human dose. In this study, they observed no adverse effects on embryo-fetal development both in rats or mice, except when the offspring of rats treated at doses 10.2 times higher than the maximum recommended dose for humans. Moving on to the clinical trial for pivmecillinam for phase 1, Zhang et al. In the study conducted this trial in a single-center open-label study which included 34 healthy Chinese subjects aged 18 to 45 with a balanced ratio of male to female. They found out that there were no severe adverse events related to pivmecillinam, but the presence of food may affect the absorption. They also concluded that the kinetics for pivmecillinam were dose-proportional increase in the Cmax and AUC, and it was dose-dependent urinary excretion.
So moving to the second phase, one of the trial is the mecillinams against genital chlamydia trachomatis infections. So it was a single-center and open-label study involving 20 asymptomatic and heterosexual male patients with a first wave of urine sample found to be positive for chlamydia trachomatis. However, this particular study was terminated after 20 participants due to a high frequency of treatment failure. And there was a low cure rate and uncertainty about the intracellular availability and attained percentage time awareness as well. Next, for the third phase, one of the trial is oral beta-lactam step-down in bacterial E. coli UTI. So it was a multi-center, single-masking and retrospective cohort study involving 207 patients with bacterial E. coli UTI. So the finding from the study was that E. coli is the responsible organism in nearly all the UTI cases, and oral beta-lactam are a safe and effective step-down for patients with E. coli bacterial UTI. As for phase 4, one of the trial is the 3 versus 5 days of pivmecillinam for community-acquired uncomplicated lower UTI. It was a multi-center, parallel randomized, placebo-controlled, and double-blinded RCT. And it involved 368 women from Denmark with symptoms compatible with UTI. The findings from the study include the mean time to symptoms resolution is 2.91 days, and the clinical success for the study was 76% for a 5-day course versus 73% for the 3-day course. And the bacteriological success for a 5-day course was 88% versus 87% for a 3-day course. So the conclusion to this study is that the 5-day course is not superior to the 3-day course.
So that is all for our presentation today. Thank you for your attention.